I just wanted to say welcome to everyone in attendance today, and welcome to folks who are watching the recording. My name is Max Backer, and I'm the community manager here at Work It Health. And this is the first session of a three-part series entitled Crucial Conversations, Effective Skills for Addressing Substance Use in the Workplace. This webinar series will take you step by step through how to recognize signs that an employee may be struggling with substance use, and how to engage in these conversations with care, and how to support your employees in recovery and beyond. This is session 1, engaging employees who struggle with alcohol and addiction. All right, Work It Health offers clinically proven virtual care for substance use, mental health, and co-occurring disorders. We offer a number of services, including on-demand intervention, relapse prevention, and addiction treatment for employees who are seeking help. The services at Work It Health are either already a part of your employee's benefits program or covered by a health plan. And I want to welcome today's presenters. We have members of Work It Health's Behavioral Health and Partnerships. Our presenters are Faye Zenoff, Vice President of Partnerships, Grant Voiles, Behavioral Health Lead in Georgia, and Dr. Brian Spitzbergen, Vice President of Behavioral Health. And they will be leading us through best practices for engaging in conversations and answer all of your questions at the end. A special note, all of our presenters today are not only experts in their field, but are also people in recovery, myself included. And as a bit of an outline for today's session, Faye will be defining the scope of the challenge, and Brian will discuss signs to look for and how to prepare yourselves for these crucial conversations with your employees. And Grant will be discussing engaging employees and next steps. Finally, we will leave time at the end of this presentation for a Q&A to answer any questions that come up in this conversation. And with that, I am going to hand it over to Faye Zenoff, our Vice President of Partnerships. Faye?
Thank you. So I'd like to first frame the issue in terms of prevalence. Before COVID, data showed that over 20 million people in the US had a diagnosable substance use disorder. That's approximately 1 in 10. Of those, 75% were gainfully employed. That translates to approximately 1 in 8 workers in the US. But since COVID, a study recently exposed that 60% of workers self-reported an increase in their own drinking, and 49% indicated that they now have an unhealthy relationship with alcohol or other drugs. That's 3 times as many people struggling with substances, many of whom will soon be returning to the workplace. The challenge is 90% of people won't find help for this problem. Why? We suspect this is primarily due to stigma and fear of backlash, getting fired, losing face, hurting their own reputation. People don't realize that there are discreet, accessible, clinically effective treatment options, and that freedom from addiction is absolutely possible. That's why this is a crucial conversation, because you, as a manager or as a colleague, can help eliminate the barriers, the shame, and ignorance, and offer real support. Through a crucial conversation, you can be the key to saving a person's life, to changing a person's future. Next slide, please. Clearly, this impacts far more than just the individual whose substance use is out of control. From a corporation's bottom line to their boardroom, companies are feeling the cost and consequences of untreated addiction. You can see from this slide that substance use disorders and addiction cost American employers approximately $92 billion. Some would estimate as high as $400 billion in lost profits each year. This is calculated by the loss in productivity, high turnover, theft, accidents, absenteeism, and decreases in the quality of work, among other related consequences. Even before COVID, 23% of adults reported working under the influence, drinking before work, or drinking during the workday. At a minimum, this impacts productivity and increases all kinds of risk. To that point, 65% of on-the-job accidents involve alcohol or drugs. Well, what about those who are not using? 21% of employees report being put in direct jeopardy or their work product harmed as a result of a colleague's use. What's more is the increase in opioid overdose and alcohol-related deaths means a shrinking workforce and shorter lifespans. Couple that with a great resignation, and we can see why, understandably, employers are investing heavily in keeping their workforce healthy and happy. Next slide, please. So here's the good news. Evidence-based treatment for addiction facilitated by an employer has been shown to be successful. That means decreasing absenteeism rates, workplace conflicts, productivity problems, and increasing the health and wellness of your team and broader workforce. In fact, people in recovery miss far fewer days of work on average than the general population and tend to be far more motivated and productive. And there are 23 million of us in recovery to prove that. And the great news is that with a digital solution like Work at Health, which can be covered, as was said, by your employer or insurance plan, you can put treatment solutions and critical support directly into the hands of every employee who needs it. So now that we've set the stage, let's learn how to have a crucial conversation. Brian?
Thank you, Faye. And when we talk about crucial conversation, I really think the place we need to start is to talk about what addiction is. And in society, often we find a lot of cross terminology that speaks to addiction. Sometimes it's often framed as substance abuse, misuse, dependence, and sometimes a substance use disorder, which is the clinical term, but we'll use the term addiction because it's pretty universal. One of the things that's really important to know, and as a starting point, is that addiction really is a brain disorder. And as such, a person's body, mind, and spirit are all going to, and emotions are all going to be affected by this disorder. It's a primary health condition, meaning that it has diagnosable features, excuse me. It's and the two diagnostic features that we're really most interested in are going to be tolerance, meaning that a person who, may have had a certain amount that would create a certain effect when they started using into a much larger and greater amount over time, and that it took more and more of a substance to create the desired effect. The other aspect would be progression, which means that use typically increases over time to a point where it really overtakes a person's daily life and functioning and activities, if you will. So as a person continues to use, what ends up happening is they end up suffering significant consequences. And as we know, we spend a significant portion of our time and our energy in the workplace, which is going to have a significant rollover and result because of that. One thing that's interesting to note is that, like other health conditions, being that this is a primary health condition unto itself, is that it has stages. And one of the ways that I think is kind of an easy way to conceptualize that would be like cancer. Cancer has 4 stages, and quite often in our field or in the health field, most of general society would probably know that at this point. When it comes to substance use and addiction, there are 3 stages: early, middle, and late. And oftentimes people don't know that. And what they tend to recognize is the stage that's easy to recognize, easy to diagnose, and because you can see it. But addiction happens long before oftentimes we can see it. So it is also similar to other diseases. Think of diseases that over time will, end your life early in that it's progressive, meaning that it gets worse. It's chronic, meaning that it affects you all the time, and fatal if left untreated. And addiction is definitely fits all of those things. And it certainly leads to a decline in all the key areas that would affect a person's health and well-being in all areas of their life, including the workplace, as we spoke to mental, emotional, and physical health. And we can move on next to the next slide. So when we look at signs to look for in the workplace, I think that if we if we look at some key areas that we have listed here, I think we can kind of frame these out into what I would call symptoms or situations that are going to be applicable to things that we would really want to look for. One bucket that I would fit that into is leave in attendance. But what I want to kind of frame out for that a little bit is some of the behavior that we start to notice, right? We might not see a person necessarily using, but we might see behaviors. We might see absences, we might see tardiness, we might see sick time, we might see emergencies that consistently come up. We might see disappearances during the workday. These are all things that become irregularities that, as they become patterns, might become interesting to us to be able to recognize if that's a sign. Another bucket would be performance problems. And a lot of that is going to be, depending on your organization and your business, could be everything from incomplete assignments to missed deadlines to not understanding the nature of the work, and right down to, kind of more advanced behaviors like, financial difficulties that would require cash advances or paycheck advances. Another bucket, which I think is also important, is relationships within the workplace, and we'll see behaviors that are very indicative of a potential problem. Everything from conflict in the workplace to belligerence to something that I think is a very key and important thing, which is a person who struggles with feedback when they've been in a circumstance where they've, maybe had a performance review or difficulty with a situation with a coworker that required intervention. And I also think isolation. Workplaces, most of the time are a place where folks are able to interact with one another. And when a person's behavior changes to a place where they become isolated, that's another concern. And then lastly, odd behaviors. And those tend to be behaviors that, perhaps don't necessarily fit directly into the work culture or just seem kind of out of place. And some of them can be physical symptoms. Some of them can be, an ordinary, kind of use of things like, mouthwash or, sprays or stuff like that. And certainly kind of behavior as well around laughter and inappropriate kinds of things. We can move to the next slide. So when we prepare for this conversation, when we recognize that there's a problem, I think one thing that is very important to consider is where we are in this process and kind of who we are in this process. And so the first thing that becomes really important for us is to understand what we know about our organization's policies and procedures regarding substance use and what kinds of help and services are available. It's important to remember that just because an organization may have policies and procedures around that and help and opportunity doesn't necessarily mean that the person that we're going to talk to is going to be ready for that. So we need to kind of think about in preparation where we're at with this and our level of readiness. So we need to kind of know where we're at. So for example, this conversation is likely to be very difficult, and as Grant will speak to in a minute, he'll talk a little bit more about what some of the difficulties around that are. But for us, preparing for this not to be an easy conversation is first and foremost. So we need to be ready for things like a person to be defensive. We need to be ready for how a person is going to respond to something that, generally speaking, they're not going to want to have a conversation about. So one thing we would want to do, for example, is be very discreet. Understand that because it's a difficult conversation, we want to be able to respect the person's privacy, create an environment that's safe, do it in a place that's confidential. For our own kind of well-being, it's great to have documents and examples for ourselves about observations about this person we might want to talk to, so that we're grounded and that we feel confident in the conversation that we're going to have. And just know that one of the things that we're trying to accomplish is just start a conversation and person down the path and that we approach with care and really not look at this as confrontation, because historically confrontation will not work well with somebody that's struggling with addiction. And so I'm going to pass it on to Grant, and Grant, you're on.
All right, thank you, Brian, and welcome to all of y'all who are in attendance today. Looking at these crucial conversations, I think before we get into, maybe what we should say or what are some ideas of what we should say, I'd like to touch on the things we should not say, things that we want to avoid in order to make these conversations go as smooth as possible. I think one of the things to keep in mind is that no person wants to have a problem with alcohol or other drugs. They may enjoy using them, they may develop a problem, but they don't actually want that problem. Sometimes keeping that in our head can help us be a little more even keeled, a little more open-minded to what they are going through. Our job as managers is not to diagnose. Diagnosis should be left, of course, to those who are clinically able to. So we're bearing that in mind. We want to try to avoid labeling as much as possible. There's many different ways that labeling can come off, whether it's the more direct, such as, I feel like you're an alcoholic, or you're acting like an alcoholic, you smell like an alcoholic. There's the more indirect labeling as well, such as, I've got a cousin that uses a lot of pills and you're sort of starting to remind me of her. Any of the labeling is going to breed some confrontation, some defensiveness naturally. What we want to stay focused a little more on behavior and things that are a little more concrete for us as managers than getting into any sort of labeling. We also want to avoid what I call absolute statements, and absolute statements usually center around the words always or never. You always do this, you're always late, you're always sloppy with your work, you never hit a deadline, you're never on time for a meeting. Even if that may be true, once we throw those absolute words in there, again, you're most likely going to be met with some resistance. We want to avoid being confrontational, avoid being argumentative, and avoid being vague as well. Really, if we stay within those parameters, a lot of times the conversation will go at least a little bit easier than we think. Could I get the next slide, please? When thinking about what to say, let's keep in mind that the point of these conversations is collaboration, not confrontation. We want to work with this individual. We want to work as a team. We want to be supportive for them. We want to work together to get to the next right step for whatever it is that will get us going in the right direction to help this individual and to help our organization as a whole, even if it's a very small step. So we want to focus on that collaboration with them. To help that get a little bit easier, get to the point relatively quickly when we're in the conversation. Oftentimes with difficult conversations, people may dance around the issue for a little bit, or sort of circle around hoping somebody else brings it up. Just once you've had your introduction and explained some pleasantries, just get to why we're having this conversation, what is going on. That will just help ease the anxiety out of the room a little bit more for both of you. Focus on behavior, not the person. From a managerial standpoint, we don't have an issue with this employee as a person. We have an issue with the behavior. We have an issue with what they are doing. We're not here to attack them personally, whether we like them personally or not. We're here to address a certain set of behaviors and try to correct those. We want to use what every therapist's favorite thing is the I statement. And some of y'all may be familiar with those, but that's basically beginning a lot of statements with I and focusing on the observation. I've noticed that for the past few weeks, you're late every Monday morning. Is there something going on Sunday night that's affecting your ability to get here on time? I've noticed that your numbers this past month have not been looking as good as previous months, and that's just, that's really not you or your productivity. Could you tell me a little more about why you think that your numbers are not where they should be? We want to stick with the observations and with the concrete stuff, and we want to use the I. This is stuff that, as a manager, I have noticed, and we're able to point that out and start addressing it. It's a lot more digestible for someone to hear and a lot easier to take than lumping on somebody or saying, well, you have been subpar this month and you have not been meeting your goals. We want to continue to establish our desire to work toward improvement with this individual, and we want to work with them in establishing a goal rather than imposing our own goal on them. What is their goal with this issue that we're talking about, with the substance use problem? Where do they see themselves? Where do they want to go? And how can we help them get there? Can I get the next slide, please, Max? And of course, the meeting with resistance, anger, denial, fear, sadness, these type of conversations may bring up any of these emotions, maybe all of them, maybe none. In fact, maybe no emotions at all, in fact. Going into it as a manager, we have to anticipate that there may be a wide range of emotions, and we really can't predict how somebody's going to react or what we're going to see when we're having this conversation. Keep in mind that we want to respond, not react. We want to take the time to make sure we have a thought out response to the emotion as opposed to a reaction, and focus on that their emotion is not directed at us as people. They're not really angry at us personally. They're angry at the situation. They may be angry at themselves, but it has very little to nothing to do with the manager. It just has to do with what is going on with them, and that this issue has been brought up. We always want to remain supportive throughout the entire process. Like I said, we're here for collaboration. Even if they are not in a place where they want a lot of support, we want to leave that door open, that we are supportive for them. And that's something that can be revisited in the future, or should they change their mind. If at any time it seems like the conversation or the session has gone very south, it's getting very unproductive, it's getting even detrimental, feel free to take a time out, put a pin in it, and disengage for a little while. And we can set up a time to have another conversation in the future with that employee. We don't want to keep digging and digging if we already find ourselves in a very unproductive hole. And we do want to set up a follow-up appointment with them. These type of issues are usually not resolved with one conversation. So we want to set up a follow-up just to sort of see where they are in a week or 2 weeks or 4 weeks and what sort of progress they have made. And then for our own well-being, we may need to debrief with somebody about what just happened and how we're feeling about things. We may need to talk with our own supervisor or someone of that nature who can just sort of help us let our own emotions out after such a heavy conversation. I think we can flip to the next slide, please.
All right, and speaking of some of the resources that you mentioned, Grant, of course, you or your employees can get in touch with us at Work It Health. We provide coaching, counseling, treatment, and much more. There's internal resources like your EAP department, speaking with your benefits coordinator. We wanted to highlight some external resources to help get you started. specifically the Substance Abuse and Mental Health Services Administration at www.samhsa.gov, and my relationship with alcohol.com, where folks are able to do a self-assessment. There are so many options for treatment out there now, including telemedicine, which is what Work at Health does, inpatient programs, outpatient programs, medication-assisted treatment, abstinence-based treatment, as well as harm reduction models, which is also Work at Health, and peer-based fellowships like AA, others. What's next for you and what's next for these sessions? Providing support during and after treatment, creating a recovery conducive culture, and normalizing sobriety and celebrating recovery within your workplace. Now, at this time, we'd love to answer your questions. You can go ahead and raise your hand if you're comfortable using your voice, but we also have chat option and Q&A option available to you if you want to go ahead and put them in chat. And again, I want to thank you all so much for attending session 1 of this 3-part series, Crucial Conversations. Please note the dates for sessions 2 and 3, May 25th and June 15th at this very same time, 1 to 1:30 p.m. Eastern Standard Time. I'm going to go ahead and put the registration links for those sessions as well in our chat. So I'm going to go ahead and stop sharing at this moment and bring all of our participants up. Again, any questions, you can go ahead and put them in chat, Q&A option as well, or go ahead and raise your hand and I'll come around and grab it. All right, not seeing any questions yet. So I'm going to go ahead and ask our presenters if there's any kind of final notes or maybe sneak peek into the next couple sessions and their importance to continuing this particular series as we are on our last minute.
Oh, thanks. I want to thank those who have joined us today. And I was actually interested to know if anybody has a specific incident with a current member of their team that they wanted to discuss, but I realized that we're about out of time, but we can stay on longer. These webinars were designed for you at the request of your EAP and HR folks, and we would love to hear from you how we can support you to be effective with your team. So feel free to send us an email or text or visit our website to learn more.
All right, y'all, thank you again so much. Thank you to our presenters as well, and we hope to see you at our next session.